today is International Day of Disability. With that day, with people with a disability, we're celebrating. And it's on December 3rd every year. And right now we're going to focus on some work that they're doing at the Bairnsdale Regional Health Service to improve access and health outcomes for people with a disability. And involved in that audit process is Disability Liaison Officer April Freely, who's actually joining us now. Good morning, April. Thanks for joining us.
Good morning. How are you?
Oh, wonderful. How are you this morning?
I'm good, and yes, happy International Day for People with Disabilities.
Yes, that's wonderful, and loving that we're making people aware, and especially those living with myself, who has invisible disability that you can't see on the outside, but struggling from the inside. So it's wonderful to celebrate all people living with a disability.
Absolutely.
And tell me, April, what this review will examine at Bairnsdale Regional Health.
Bairnsdale Regional Health are so excited to partner with Get Skilled Access, which is a disability-owned business enterprise based in Melbourne, who undertake audits for inclusion and accessibility for businesses. So we've been invited to partake in a program called Inclusive Healthcare. So the program is designed for hospitals for people with disability by people with disability. So it's about improving access across hospitals.
And April, what do you know already about these experiences of people living with a disability and when they're accessing healthcare?
People with disability more often access healthcare than people without disabilities. So they are more commonly in the hospital space, either as inpatients, outpatients, and using community services. But they also experience many more challenges. For instance, it's not often accessible for consultants to have accessible treatment tables, accessing equipment to undertake scans and x-rays and procedures. There's often a lot of trauma around experience in hospitals based on their copious use of services, and often the trauma involved in some acquired disabilities. So it can be very overwhelming, it can be very challenging. The information often is not accessible in formats that people require. So it's about providing access in a variety of ways that they actually engage with health services.
And April, I was looking at some data from the federal government, and 1 in 2 people aged 5 to 64 with a disability who need healthcare assistance receive only informal assistance, which I understand is support from family and friends. Is this happening in East Gippsland?
So we often have people with disabilities who are supported by informal support networks coming to the organisation. So my role is about assisting that in a formal way to access healthcare, but it's also about encouraging people to be able to use health services without informal support. And that's about empowering people with disabilities to control their own life and make their own choices.
And part of this audit process is about educating staff. And how will people with these disabilities and those with lived experience be a part of this?
So as I said, Get Skilled Access is an agency that is predominantly operated by people with disabilities. So they will come in and assess our agency from a variety of perspectives. People with vision impairments, people with physical mobility disability. So they will come and assess from a variety of aspects, and they will make recommendations to the hospital in terms of what we need to improve our service. And then the education component to the hospital will be a 2-phase program. So we're going to have a small cohort of staff trained as disability inclusion experts that will provide peer support to the rest of the organisation. And then the whole hospital will receive disability awareness inclusion training. So everyone will actually learn how to identify disability. Because as you said, there is a lot of invisible disability. Approximately 9 in 10 people with disabilities, it's not visible.
Wow.
So it's about assisting our staff to actually understand and identify when someone is presenting with a disability, and then how to appropriately engage in that conversation and find out what their needs are, because we know that to make an accessible service, we actually have to adapt our needs to each individual. We can have two people with autism spectrum disorder, and their experiences and their barriers to accessing services can be vastly different.
Definitely. And yes, like I said, coming from experience, it makes me very happy to hear that you are making people aware, and this program will, educate the services and educate staff and everyone, really, not just the health industry, but everyone around Australia and Gippsland about people living with a disability. And like you said, invisible disability or not, either way, it's an important discussion that we need to talk about.
Yes,
all the time. It is hard to make people aware and discuss these issues that we're going through.
Absolutely. There is approximately 1 in 5 people with disabilities in East Gippsland. So it's really important that we actually learn to adapt and modify our services to make it an inclusive service for everyone.
Fantastic. April Freely, thank you so much for taking the time out this morning and joining us.
Thank you very much.
April Freely there, Bairnsdale Regional Health Service Disability Liaison Officer, talking about the new program announcing a major audit of services and processes to improve access and health outcomes for people with a disability.